Well, Naledi, here at Pelonomi Hospital is a different picture other than what you have said to me. Here patients are being returned home because there is no one to treat them. A majority of workers at this hospital are NEHAWU affiliated members, and the spokesperson of the health department in the province, Aphumelele Mdlalane, has also indicated, or rather confirmed to us, that it is a dire situation. Doctors are working alone inside this big hospital in the province. One can imagine how many patients have been abandoned, how many patients are yet to be treated, and those that are being turned back to their homes without being treated. But I just want to bring now Aphumelele Mdlalane, the spokesperson of health in the province. Let's talk about the issue of the court interdict. You mentioned that there's been intimidations to workers since Monday.
Yes. Well, you would know that not every employee is part of the strike. Some of them are diligent people that want to be in the wards taking care of their patients, but they've been intimidated. Some of them have been dragged out of the wards whilst treating patients, assisting doctors, because since Monday doctors have been the ones at the forefront who've been doing all the work and who've been filling in for what nurses would normally do, giving attentive care to patients in each and every different ward. Now it's a dire situation. It's not what is happening is not what a healthcare system should be, and it surprises us as the Department of Health, because this is a public sector strike, wage strike. It's not a health strike. And we think that under normal circumstances, in a morally conscious society, health would be the last service that would be interrupted whenever there's a strike. Health is classified as an essential service. This is a matter of life and death. You need attentive care of patients, and if that attentive care of patients is not given, then you've got serious problems. Healthcare is nurse-driven, because the nurses must be the ones that are looking after the patients in post-operative care. They are the ones that are preparing the patients even before the operations are happening. They're the ones that are able to interact directly with the patients, so that even doctors, when they come, they are given briefings by the nurses on the progress of the patients from time to time. So it's a dire situation in that sense, and it's an undesirable and untenable situation.
So now, any contingency measures, as we know, this is one of the biggest hospitals in the province, given that the patients have been left unattended to?
Well, contingency plan is that those patients that are strong enough, that were already waiting to be released, you must expedite their release so that they go and recuperate at home in the care of their loved ones, instead of people coming to visit them in the hospital. You are decongesting the hospital in that way. Elective surgeries are not being done. It's emergency cases that we have to deal with, but that is also not helpful, because you then have some other patients that cannot be discharged, whose conditions is going to regress, because one, there's no medicine that is available for some of them, because medicine is supposed to be administered by nurses, cleaning is supposed to be administered by cleaners who are autoclaves are supposed to be done. There's no one who is doing that. Radiology is closed completely. Administration is closed completely. So it's difficult to can admit patients, and as a result, we've got to be fair to our people and say it is not of our making as the Department of Health. It is the situation as it is presented. We are not arguing against the legitimacy of wage demands, but is the health of people worthy of being risked at the expense of the wages, fighting for wages?
And those that are in the intensive care unit?
The intensive care unit this morning, just before I came to you now, I was getting a briefing because I went to check in the intensive care unit. That's our primary concern whenever we come to the hospital. People that were working in the intensive care unit were forcibly evacuated today. It's sad. How do you get people out of the intensive care unit who are supposed to be looking after people that are, dependent on life support to go on? Those people, they need attentive care every second. Now doctors have to do that. But they are doing their best to take care of them.
Well, that is the Free State spokesperson for Health Department, Mondli Mvambi, indicating that at the intensive care unit, it's the doctors now. We must imagine that is the critical unit of the hospital, saying that the workers, they were forced to come join the strike. Therefore, as a result now, the doctors are the ones who are busy with the operations. However, he has also indicated that those that were supposed to be released, I'm talking about now the patients that were supposed to be sent home, have been, of course, asked to go home without even the official release, as we know that workers continue to protest over the salary wages as well as the issue of the housing allowances. So the situation is dire here at Pelonomi Hospital.